What we're going to do next is have our keynote speaker, and I'm absolutely delighted that Linda Gibbs has made the trip all the way out here to California to be with us and will be our keynote speaker here today. She is an extraordinary leader in the evidence-based policy space, especially as it intersects with local government leadership. And she was a visionary as deputy mayor of Health and Human Services in New York City, where she spearheaded major initiatives on poverty alleviation, juvenile justice reform, and obesity reduction. And we at JPAL North America have really benefited from having Linda as a thought partner as we were developing this initiative, and have just learned so much from her. So we're delighted to have her here this morning, and please join me in welcoming Linda.
If I just hit down, will it go to, look at that, you're all set, good. Good morning, everybody. I was really, really thrilled to be invited to be here. It's always nice to be in a room of people that you know agree with you, right? It's not always, it's like good, like-minded people. You know, maybe we do that. That's actually one of my messages. We can't always be with like-minded people, but right now it feels good. All right, I have one question that I want to just get started with. Have just a show of hands, anybody who's taken an online course from like edX, Coursera, as I expected. Wow, I should have asked the opposite. Has anybody taken the poverty class from the founders of JPAL, Duflo and Banerjee? Put it, one? Is that a half of one? Were you a dropout? Yeah. All right, I'm gonna, so this is, I wanted, this is full disclosure. I took the class like, I don't know, 3 years ago, and I got an 86. That's like a B. Like, that's not good, right? Right? It's like, look, here I am. So I'm taking the class again, because I know I can do better. And so it just started. I'm just beginning. And so, so Marianne, I expect extra credit. I'm just saying, because I need to get over that 95 mark. But it's really, I'm fascinated with all of that. Whole different conversation, but it's also a lot of fun. Okay, so here is, I mean, we're the champions, right? We're the folks who care about evaluation, who are willing to take the leap and do the evaluations, knowing that it's going to, you know, put the full truth out there to the whole world. And I guess my big question for this conversation that I'd love to use our time that we have in question and answer right after is how do we turn kind of the passion and commitment that the people in this room feel into a culture that defines our entire government. I come to this from the perspective of the government service provider, and I really love the comments that Marianne made about the need for us to find better alignment with our academic partners around the research. And so the case is that the vast majority, I don't know what it looks like in your city, but in New York City, where I practiced for 30 years, the vast majority of the programs are not evaluated and don't have, you know, didn't start with an outcome goal and aren't evaluated along the way and can't even say whether or not they're, you know, they're doing God's work. That's what they can say. And so this kind of a rigorous evaluation, it's still the exception. It's not the norm. And we, you know, doing God's work, and in New York, I think it's typical of many cities, or most of our services are provided by nonprofits under contract with the city. You know, they are really committed, hardworking, very passionate, they do it nothing but to make the lives of the children and family they serve better. But they don't devote the same time and energy to understanding whether or not their services have an impact. So my question is, what do we do to take it from, you know, this room to, you know, the biggest convention hall that you can imagine of people committed to this and doing this work? I think I have 3 cases that I'm going to share with you that tell a little bit of the story of some of my experiences. But as I thought about, instead of diving right into them and pulling some lessons up, I wanted to just step back and say that I think a really critical part of what is necessary to change the culture is this concept of open-mindedness. Now it sounds, like a very straightforward thing, but there are books and, treatises written on this concept of open-mindedness. And I've tried to read them because I think it's important, like what makes for open-mindedness and how you can get yourself there. I think it's a constantly ongoing personal task, but then how you can bring your network of partners and your broader community along. And so some of the characteristics, this is not, people with PhDs write it, so I guess it is kind of rocket science of the mind. But the concept around open-mindedness is essentially, I think it's not just about honesty, it's about curiosity and a willingness to challenge your own thinking by really listening to and responding to others' thinking. So being open to other people, other points of view. So back to like-minded people, being willing to sit at a table with other people who are not like-minded and really, really listen. Not just like listen for how am I going to, cut you down, but listen for what do you have to say that's important that I can learn from. And the willingness to try new things and to embrace change. That's another whole level of, if you're focused on an outcome and you want to improve an outcome, something other than doing more of what you're doing or tinkering with what you're doing, but being willing to try radical new approaches that may even counter some of your fundamental starting points in order to see what it produces. So being curious, open-minded, open to other points of view, willing to embrace change. And I think the last one, particularly for those of us, who are those in the room who are in government service? It's like, right, so it's, how hard it is to be a reformer from within, because you have to stand in front of the press and defend what's going on and do it in a way that's not defensive, that that you're the one who's on the front line, who's got to explain when things go bad. And to be able to recognize failures and recognize faults and take it in stride is incredibly challenging. And I can tell you, in my 30 years of city government service, I wasn't always so great at it. Sometimes I would leave a room and I'm like, what did you just say? That was ridiculous. You screwed that up. Why are you up there telling everybody it's okay, right? And so, and I think part of the problem is, and the press is so got you, and your political opponents are so got you, that it's really, really hard to embrace that failure is part of the process, and that when failure happens, the best thing to do is to put it out there and to discuss it honestly and to discuss it as a building block toward getting to the goal that you embrace. And so I think this concept of open-mindedness, we can't do the work that we do unless we're willing to be all of these things. And the question is, how do we create institutions and an institutional culture that allows for that so that we're not the exception and we are the norm? That being said, so that I think is the tough part. The second half is what people say is the tough part, and it's really actually a lot easier, getting easier. And that is just getting our hands on the data. It's all over the place. I've so many, I'm going to stop asking you to raise hands because now I'll be embarrassed to be the only one in the room that raises her hand when she says, I typed my term papers for college and law school on a typewriter. There were no such things as computers, and there were not laptops, there were not even desktops. I remember when the first desktop appeared in my law school advisor's office, we all of us, we went in at once and we're like, oh my God, that is so cool, right? It's like, what does it do, and then moving through, decades of work in public service, we collect data like crazy now. I can't even imagine if anybody counts how much data is out there, it's probably uncountable. But there's so much of it and it's all over the place and it is largely untapped. So that's an incredible resource. That's it's untapped, but it's an incredible resource because it's knowledge out there waiting to be found. The other really amazing thing that is happening is that the technology costs are dropping like I got to come up with better words than crazy and amazing. The technology costs are plummeting. They are plummeting. It's unbelievable. I'll tell you, I did an integrated data system for sort of a client view in New York City 15 years ago. I think we spent $100 million on that thing. And it was like, okay, that's all right. That one I'm not going to admit. Keep the door closed. You can do that for $100,000 now. It's just amazing that how the technology has sped forward, and the costs of doing the programming and building the architecture that can access and integrate the data, connecting those clients across systems is it's unbelievable. And we all know that there are amazing tools out there. There's that word again. There are such impressive tools out there that that allow us to look at data in new ways, and they are available. They're in use, all over the private sector, and they are not very highly in use in the public sector. So these two things, I think, about thinking about how government can be better at accessing and using all these advances in technology and bringing them to bear on our vast administrative data sets, combined with a culture of open-mindedness, I think can just, open the floodgates to an incredible amount of knowledge and learning. But it ain't easy. So I have one long case study and two short case studies. So that means 5 minutes, well, no, I'm talkative, so 10 minutes, 5 minutes, 5 minutes. Closing thoughts, and then so we can conversation of where you can tell me what the solutions are to this challenge. So the first one in New York City, juvenile justice reform. When I, let's see how this started, our Young Men's Initiative. So this is actually one that was a little bit, it's a great story, but it was a little bit later in my iterations of service. This was the last term of Michael Bloomberg when I was at City Hall as the Deputy Mayor for Health and Human Services, where I foolishly asked him to include juvenile justice, probation, and corrections in my portfolio, and he said yes. And I'm like, oh no, now what do I do? But the whole idea, it's pretty logical, is you want to connect the human service agencies to more closely to the justice agencies so that there can be better coordination of services and programming to get better results. And so I said, okay, let's get the ball rolling. We had a fantastic group of commissioners who were very reform-minded. And we said our goal is that we wanted to reduce juvenile detention and placement without risks to public safety. We can keep more kids home in the community without increasing their arrests and, without increasing crime. Here's what is the startling fact that drove us forward. A study of youth placement, for those of you who don't do the juvenile justice work, placement is the phrase for confinement after conviction. And so juvenile, if you are in New York State, if you are a juvenile placed in state care after conviction, after release, you have is it the same? You have 89% of those youth after release were not rearrested, reincarcerated within 3 years. So basically, if you're in juvenile placement, don't unpack your bags because you're coming back. Right? It was like just a death sentence for a life of being sucked into the justice system. So our goal is we wanted to keep kids out. Anything that we could do to keep kids out of confinement, we believed was a necessary step to breaking this cycle of incarceration. The big challenge in juvenile justice reform is that, and this is the same for adult justice as well, is that it is a system that doesn't act as a system. If you touched every public agency, if you map them out as an assembly line from beginning to end, you have city agencies, county agencies, state agencies. You've got independently elected mayors, county executives, sheriffs, judges. You have different philosophical predispositions. So each of those entities, maybe they have political agendas. Needless to say, they've run against each other at some point in the past, so there's got baggage from their own personal histories. But institutionally, they carry different agendas. And so it's a system that's not a system. No one entity holds them all together. And what was really striking to me in the first time that we brought everybody together to the table, not only do they not look eye to eye in talking to each other, their data doesn't talk to each other. I said, okay, let's just start with the facts. Everybody just come to the meeting and bring your data. What do you collect? Any kind of population management, any kind of outcome stuff. Let's just tell the story. Let's tell each other the story of juvenile justice in New York City. And nobody's data. Like, some counted it as cases, some counted it as kids, some counted it as incidences. The drop-off point didn't match the pickup point. There was just no talking. Time frames were different. We spent over a year just getting the data to talk to each other and tell a story. And that, I think, is that I carry that lesson as one of the most important lessons for this use of data in system reform, because the power of the data and the curiosity that it provoked among the people at the table and the questions and answers that it stimulated became the foundation for a common understanding of what was going on and a common framework for action. And there was plenty, you can imagine, plenty of else going on, talking about, systems change and programs, but the data was an incredibly powerful force in moving the conversation forward. I know you can't read this, but this is our risk assessment instrument. That's good, right? You can't ask me any hard questions. I knew you would be able to see this, the chart in the center. So this is a one-pager that can be done at point of arrest. We went through the data sets that we had, and we worked with the Vera Institute. I'm sure many of you know Vera. And we looked at the criteria. By looking at lots and lots and lots of stuff, we looked at the criteria that would that were predictors of failure to appear. Is this set of predictors? And risk of rearrest is this set of predictors. Failure to appear, risk of rearrest. And we're able to identify high, medium, and low risk kids. And so the low is that top left corner. And the low and medium categories, medium is the yellow middle, are the vast majority of the kids. And high, even though it included the most boxes, were the lowest number of kids. And so this was a tool that we said, if our goal is to keep kids out, and our belief is that the way to safely keep them out in the community is to build appropriate services so that they can be released to their parents or their custodian supervision with support when necessary, then we needed to know which kids should get which services and which kids really did best be held in detention pending their trial. We applied this instrument to a baseline of young people in 2006. And what we found is that in 2006, without the risk assessment instrument, so this was looking backwards, 24% of low-risk kids were detained, 39% of medium-risk kids, and 49% of high-risk kids. So in the before, applying this instrument in the before category, we saw that breakout. Overall, So then we worked really carefully, closely, long time, starting with a lead reform-minded judge and getting that judge to say, oh, I get it, and we've spent lots of time with that judge, and then that judge brought on that borough, and then that borough brought on the next borough. But we worked a lot closely to get them to believe, and with the prosecutors, to get them to believe that this was an accurate predictor. It was something that was information to them. It was not a mandate. They used it to inform their judgment, but everybody could override it. Probation officers could override it. Judges, everybody could override it. It was when it was then, we looked at 2 years later, in 2008 through 2010, we looked at the utilization. We saw that now only 9% of the low-risk kids were detained, so over 90% being sent home. Here is really critical. Low-risk kids sent home with nothing. No services. They don't need detention. They don't need services. They need to go home and get a good talking to and do their homework and straighten out. It was the medium risk kids that were the big challenge for us. Those were the kids that we believed that if they went home without services, and the services often as offering support to the parents as much as to the children, they were the ones who really needed the services in the community. And we had a whole nother layer of structured decision-making to match the range of medium risk kids to the range of appropriate services. So the medium risk kids, not too much change, down a little bit, but those kids more often going home with services. And the high-risk kids more often being detained. This looks really big. We didn't over-incarcerate. We actually reduced incarceration. It's just that as a percent of that lower group of kids, it went up to 68%. So overall, we saw a decline in detention of 20%. Now, so then here's okay. So how did it all go? For every risk level, the rates of rearrest dropped. So here's my important observation number 2. Do no harm. We were sending low-risk kids home with less services. We withdrew services from that population, and their outcomes were better. So whatever we were doing to them was harming them, right? The medium-risk kids, those were the ones who were going home with the services, down 22%. Rearrest while their cases are pending, down 22%. High-risk kids, this is not brain surgery. They're in detention. They're less likely to actually be out. They can't do harm. Overall, a 23% drop in this initial period of implementation in rearrest. So less kids in confinement and less kids arrested. So this is, and this has gone on. This has actually gotten. I only have 10 minutes. Holy smokes! Okay, this was the long one though. The other ones are short. This has improved. This is I'm out of City Hall now. I can't tell people to do charts for me. So now I just try to find them in my records. I call Tina. I'm like, Tina, do you have that record from 2007? And so some people take mercy on me and share, and otherwise I have to use old charts. Here's the really interesting thing. This is like when miracles happen. In New York City, our summer youth employment program didn't ever ask the question, are kids safer? And we did that same study, and yes, they didn't get arrested. They were safer. It was something over the period of the study, dozens of kids did not die. So not only were they not rearrested, they weren't killed, right? And but we didn't expect that. That was an unexpected result. Here's our unexpected result from juvenile justice reform in New York. Without doing anything else, we had a 65% drop in placements. So this work produced a culture shift in the juvenile justice ecosystem that now, instead of being that cacophony of people who didn't talk to each other, is now a system working as a system. And by virtue of seeing the power of this and understanding, so a kid released to the community who's then convicted is going to get released to the community as a sentence, right? So if you don't screw up on detention in the community and you're convicted, there's a great deal of leniency. The judge will gladly send you home if he believes you're not going to be a risk to the community. And so we've seen this number, and I'm sorry, the one I found, I couldn't find the 65% number, but the drop in reduction in juvenile placements. There's so much more to say there, but now I'm only down to 5 minutes, and so I have to do everything else in 5 minutes. Another example, and I promise, I'm actually going to talk about RCTs here. Another great example, who knows the Allegheny County work on integrated data systems? They are just light years ahead of anybody else I've seen. So they have a huge amount of city and state data that's integrated, and they're doing great things with it. And what they have just launched is a structured decision-making tool in child welfare. Their goal is that they wanted to improve the screening accuracy for reports of abuse and neglect. They wanted more of the right reports to get investigated. And historically, their challenge is they didn't have integrated data to help them to figure out how to better judge that. And there's resistance among their caseworkers to believing that their professional decision-making could be enhanced with a risk assessment instrument. So here's what they did. They looked across like 100 different indicators to figure out what the algorithm would be that would indicate low to high risk. They did it on a 20-point scale. They then applied that to a history of calls and found it was a pretty good read on what would happen. So of those that scored 20, 1 out of 2 of those kids after investigation wound up in foster care. Of those that scored 1, 1 out of 100 wound up in foster care. So pretty good at judging whether or not a case is a very high or low risk. And then here was the problem stat that they were working with. When they looked at this retroactively, 27% of the highest risk cases were declined for investigation. So they didn't even get an investigator to go out, high risk case. And then back to do no harm, 48% of low risk cases got screened in. And I don't have a lot here. I don't have anything here, in fact, about institutional bias. But the trauma, for anyone who knows child welfare, you know that just conducting an investigation in a household is a traumatic experience for the family, for the child, for the family, for the network around the child. So inappropriately screening in cases is causing trauma just by going through that. And then the effects of institutional bias can often produce results for Black and Latino children that are wildly disparate from white children and increase the risk that those families will actually be separated. So those false positives are painful and harmful. So where are they with this now? They've been implementing the slow adoption. The workers are really resistant. I'm a professional. I've been doing this for 15 years. Your algorithm isn't going to be better than I am. And so slow adoption. But it is applied to every case, and that information is given to the workers and their managers. And they are seeing that the low-risk screen in of cases going down. It's down to 28% now. I can't believe that my time is up. And oh, I have 5 minutes. Okay, now I get to talk about random control trials, right? It's like, come on, Linda, we didn't, invite you for anything else. I have 2. All right, I'm not going to tell you the story by going through the charts. I'm just going to tell you what the result is here. We did conditional. We had a very ambitious anti-poverty initiative in New York City where we did 40 different initiatives. We did all that open-mindedness stuff I told you about. We thought about crazy different things. We were willing to challenge ourselves. We were willing to do things that sounded ridiculous. One of my favorite moments in city government is when I came to Mayor Bloomberg with the results of a study that showed big impacts, and he said, "I always thought that was a stupid idea." And I'm like, "Yes, it won." This is one that didn't. Conditional cash transfers taken from founded in Mexico, and wildly successful anti-poverty initiative in South America, other parts of the world. We said, let's give it a try in New York City. We'll share the deck so you can see some of this, but look at the findings. It did not increase earnings. It showed no improvement in school outcomes for children. And that was the big one. The whole, the core of the program was around incentivizing work for adults and education for children. And kind of on a whim, we threw in a little piece at the end, providing transfer incentives if you did primary healthcare visits and if you did dental visits. Who knew? It's the only place in the whole study that showed impact. And so by doing the RCT as the approach to evaluating this very high-profile experiment in New York City, we got the results. It was embarrassing. My staff was going crazy, torturing the evaluators to mine the data to find wins. because they didn't want to stand up. And, quite frankly, I'm like, go for it. They didn't want to stand up and say it didn't work. We spent a lot of money in a very high-profile thing that had the mayor criticized very publicly in the press, and it didn't work. And so this is the downside, and this is the question around when you do this, you just got to know that that some stuff is going to come up, as stinkers, and you got to acknowledge it, and you've got to embrace it as part of the learning. I'm telling you what you know. There's a different story that I thought about as I was reflecting on this, and it was what we did with our CUNY ASAP. It was a goal to structure a set of supports around community college so that kids could get their degrees. You may know this nationally. I think the number is 17% of students who enroll in community college will get a 2-year degree in 3 years. And something like 25% ever, like they stopped counting at 7 years. In New York, we were much better. We did 22% in 3 years, 28% in 7 years. Not good enough, obviously. And so we wanted to create a program and we set a goal for ourselves of let's get them up to 50% getting a degrees within 3 years. The higher, I'm sorry, those of you from institutions of higher learning, but they're not particularly well oriented around degree completion for students. I think the culture is starting to change, but when we started this, no. The leadership for this came from CUNY. I don't think it would have happened if it didn't come from within. So they had to structure. They didn't even track this number. They had to structure a tracking mechanism to do this. So here's how we did this. We didn't know. It was one of 40 initiatives. We said, everybody go out there and try. Only 1 or 2 of our initiatives were random control from the start. Most of them were straight up outcome evaluations. And so in 2007, when we started, we're like, okay, enroll those kids and find out whether or not they actually get their degree in 3 years. And 3 years later, we get this report, 55%. And we're like, holy shit. This is we got something here, right? This was really good. And so we said, all right, but a plain vanilla outcome tracking is not good enough. Let's do, we use a light touch propensity score matching approach. Let's, look at a cohort of kids that were in school as our ASAP kids at the same time, and let's compare them. And so that got us, in that group was, their graduation rate was 55% again, and the comparison group, 24%. Wow, this is good. Well, now let's take it up another step. Let's do it prospectively, and on entrance, let's pick a comparison group. And so for that, nobody's ever explained to me why it went down to 48% in this year, 47% in this year. But it also went down to 20% for the comparison group. So this is the prospective propensity score matching. And then we said, okay, but this is really, really good. This could be really groundbreaking. So we said, let's do it. And we did a random control trial. And then this is interesting. I really love the reflections of people in the room on this. Random control trial, now we have 40% with the 3-year degree, and 21% in the control group, 22% with the 3-year degree. So is it something about the matching, like when this was more open, first kids past, the starting line versus random that gets you, the better group? Is this more true? Lots really, really interesting, but nonetheless, still double the rate of the 3-year degree completion. Declared victory. Continue to track. The most recent report I had, they were graduating at 58%, and the success was such that Mayor de Blasio took this to scale for every incoming full-time student at CUNY are part of this program now, and it's being replicated in a couple of other jurisdictions. I'm not going to tell you about the amazing cost-benefit analysis, but it's another benefit that you have when you have all this data. And I've said most of this, so I won't run too much more. I think my reflection on the random control trials is that, no random control trial before its time. I think it's too much of a burden to put on a brand new program. And you got to let them figure it out. You got to figure out if it has potential. Random control trials are super expensive, and at least you smile. The stop sign is flying. They're really expensive, and it's a high standard and it's a high burden, and it feels like the CUNY approach that we took. We did the same for homeless prevention, and I'm really excited to stick around tomorrow and hear and participate in the homeless discussions at your invitation. So thank you. We did a similar approach with our homeless prevention program in New York City, where we did lots of lighter touch evaluations first before we exposed it to random control. So I think that's a big takeaway. The data gathering process is really horrific. I'm doing a project now for My Brother's Keeper, and we're working nationally, and just getting those data sharing MOUs. The resistance is just amazing. It's amazing. So I want to hear and talk and learn from all of you about that today, because we gotta figure that part out, because the cost and the technology is there. And as I said, I didn't say patience and persistence, but I think that's obvious. And we've got to be better at accepting failure and recognizing it not as we're a failure, but failures happen because failures are part of the process. Thank you very much.
Could you say your name and the organization you're from?
Irina Asmussen, I'm from the California Department of Finance. So you had mentioned that you think that it's a bad idea to do this for new programs. And yet, a lot of times politically, it's actually easier to do RCTs for new programs, because we can sort of say, oh, it's an experiment. We're going to see if this works, and then bring it up to scale.
That's a great point, and you're making me remember with the conditional cash transfers, where it was so controversial. That saying that we were doing the RCT was part of the, we're going to try this crazy thing, but we're going to subject ourselves to the highest standard. I wish we figured out a way to deal with it differently. I think that I guess the challenge is, how can you leverage the moment, find a politically, responsive, answer to how you're going to hold yourself to accountability for outcomes, and not attach the full baggage of an RCT. I'm sure there are a million different opinions on this, and I'm struggling a little bit with my point of view. So I hear what you're saying. Does anybody else have a thought on that? I mean, what? Yeah, please. All the way, of course. Maybe boom until here.
From Notre Dame. My point was similar, but a little bit different. You want to evaluate the program when you're proud of it. But the longer it exists, the harder it's going to be if the numbers come back negative. And so then the people don't want to evaluate it then, because, why did you run this program for so long?
Yeah.
It's not doing anything. And so
Yeah.
what we found is it's so much easier to start evaluations on new projects that haven't been up and running for years. And I think there's a real tension there, especially with the nonprofits we've been working with.
Yeah.
If you have a program that's been running for 6 or 7 years, the notion that they're going to put it under a microscope and it's going to come back negative, this person feels their job's going to be on the line. So I think it's a real tension.
Yeah, and her job is on the line, right? Well, maybe not her job, but her program, the thing she cares about, is on the line. It could come. It was really hard to end the conditional cash transfer program. With Homebase, our prevention program, we actually did the RCT when our pilot that was working in 6 New York City neighborhoods was doing great, and we couldn't get the budget office to fund it citywide. And so we said, we're going to show you this works in the most rigorous way, and that was what was necessary to push it. And so it was like a moment in time where it was really, it was politically useful to attach the RCT at that point. I mean, I think if nonprofits have model programs and they want to go national with them, or they want to replicate within the cities that they're in or the states they're in, like introducing RCTs, it's the risk. It could go, south, but it also is an added endorsement, obviously, of the approach. It's hard, yeah.
So, sorry.
Where are you? There you are. Good.
Matt Trujillo with the Robert Wood Johnson Foundation. This is actually kind of a comment on this. And I know we're different as a national funder and not local government, but what we found success with is we always describe our evaluations for improvement, not necessarily for judgment or decisions per se. So you get findings from an evaluation, you use those findings to improve a program. That we're not necessarily going to just get up and leave or drop a program or end funding because of it. That it's really, there's a commitment here. We want good work to be sustained, and this is for the improvement of a program. Not that, I understand, again, we're different. This is different dynamics here. Yeah. But that's at least a frame switch that we found to be pretty successful.
I think that's really important, and it gets us into another whole layer of fidelity to program, and in an RCT, how much flexibility to learning along the way, particularly if the program is new. How much flexibility do you want to allow, and balancing the rigor of the RCT approach to the learning on the ground as you implement, and using early learnings from the trial to actually adjust the program, which then may screw up your trial a little bit, right? And so how do you build that in? When can you say yes and when can you say no? We did, I dropped, you'd be surprised, I had another whole case study in here, our social impact bond on Rikers Island with cognitive behavioral therapy. And that became a real sticking point. We actually had to, our CT didn't work. We had to drop down to propensity score matching, but it was still super rigid. And we found a couple of things that we knew from the get-go that it was going to destroy the program. And so we actually had to have a whole renegotiation midstream to allow us to adjust the criteria for evaluation of success. And so how can RCTs be used most effectively in an environment of learning and program design, I think is super important to issues to think through as well. Sir?
We have time for one more question.
One more, you're it.
I'm curious about when you were building the risk.
And will you identify yourself?
Oh, sorry. Andy Perry, Corporation for Supportive Housing.
Oh, fabulous.
When you were building the risk scores around juvenile rearrest, did you do anything, and if so, what, to intentionally think about racial equity and avoid training the model to reproduce the structures that cause disparate outcomes across races?
Yes, we did not include race as an item. Race was highly predictive. And we just said, no, race is not highly predictive. That is a reflection of institutional bias. We are not going to include race as an indicator in the risk assessment instrument. That being said, there are really, really smart people, coders, who are adopting methodologies, like anti-algorithms that are unbiasing. They're trying to strip out the effects of bias in data, and you can do it to a certain degree. And you can't totally reverse it. But now this is a world I'm not in. I just know they're doing it. So there's amazing things that are being done. Our most rudimentary thing is we said we don't care how predictive the history says. We know it's not race, so we're not putting it in. Okay. Well, thank you very much. Looking forward to the rest of your 2 days and enjoying all your conversation. Eager to learn more.